When we picture a Victorian birth, we tend to picture something out of Jane Austen novel, a genteel woman lying in a four-poster bed, surrounded by devoted family members, serenely bringing new life into the world. It's calm, it's dignified. Someone probably offers her a cup of tea. Here's what was actually happening. She hadn't seen a doctor in 9 months. The person attending the birth might have just come from an autopsy without washing their hands. And if things went wrong, the solution was probably to try a set of iron forceps and pray. But before we get into all of that, welcome to Victorian medicine, where we dig into the real history behind the history books. Let us know in the comments which historical topics you'd like us to cover next. All right, time to check into the Victorian maternity ward. Don't touch anything. Fact number 1. Nobody talked about it, like, at all. In the Victorian era, pregnancy was considered so intensely private and, frankly, so indecent that it was rarely spoken of in polite society. Pregnant women were expected to essentially vanish from public life the moment they started to show. No dinner parties, no outings, no being seen. The preferred euphemism was that a woman was in a delicate condition, or confined, which is interesting because confinement was also the term used for the actual period surrounding birth, during which women were expected to stay in bed for up to a month. So a Victorian woman could be in a delicate condition, then go into confinement, and then spend weeks in post-confinement's confinement. It's confinements all the way down. The real kicker: many Victorian women received almost no information about what to expect. The subject was too improper to discuss openly. Several accounts from the period describe women who had no idea they were pregnant until they were visibly so, and no idea what labor involved until it was actively happening to them, which is, to put it politely, a tremendous oversight. Fact number 2. The doctors made things significantly worse. For most of the Victorian era, the idea of a trained medical doctor attending a birth was relatively new and, in many cases, genuinely more dangerous than the alternative. Here's why. Germ theory, the idea that microscopic organisms cause disease, wasn't widely accepted until the 1860s and 1870s. Before that, doctors routinely went directly from performing autopsies on dead bodies to delivering babies, without washing their hands, because why would they? A Hungarian physician named Ignaz Semmelweis had actually figured this out in the 1840s. He was begging medical establishments to wash their hands between patients. They laughed at him. They institutionalized him. He died of an infection in 1865. In the meantime, women continued dying of childbed fever, a bacterial infection caused almost entirely by the unwashed hands of the people supposedly helping them. Joseph Lister later introduced antiseptic practices in 1867, and death rates finally began to drop. But for a large chunk of the Victorian era, you were statistically safer giving birth with an experienced midwife in a clean room than with a fancy physician who'd just come from the morgue. Just something to keep in mind next time someone tells you doctors always know best. For much of the Victorian era, the leading cause of death in childbirth were the people trying to prevent death in childbirth. Fact number 3. Chloroform was the good news. In 1847, Scottish physician James Young Simpson discovered that chloroform could be used as an anesthetic during labor. Women could now give birth with significantly less pain. A medical miracle, right? Not according to the Victorian establishment. A significant portion of religious and medical authorities argued, loudly, that pain during childbirth was divinely ordained. It was right there in Genesis. In pain you shall bring forth children. Using chloroform to reduce that pain was to these people a form of theological insubordination. So the debate wasn't really about the science, it was about whether women were entitled to relief from agony at all. The debate was effectively settled in 1853 when Queen Victoria used chloroform during the birth of her 8th child, Prince Leopold. After that, the practice became socially acceptable almost overnight, because if it was good enough for the queen, it was presumably good enough for God. Funny how that works. Fact number 4. The forceps situation. If a Victorian labor became complicated, the doctor's main intervention tool was the obstetrics forceps, essentially a large pair of iron tongs designed to clamp around a baby's head and pull. The forceps had actually been invented in the 1600s by the Chamberlain family, who kept the design a secret for a nearly century and rented themselves out to wealthy families as the only people who could perform difficult deliveries. They'd arrive with the forceps in a locked box and clear the room before using them so no one could steal their invention. Medical ethics weren't exactly front and center. By the Victorian era, forceps were widely available. Unfortunately, so were the people using them, many of whom had minimal training and maximum confidence. Improper use could fracture a baby's skull, damage the mother's tissue, or cause injuries that lasted a lifetime. They were, by most accounts, terrifying, and yet they remained the primary emergency intervention for the entire century, because the alternative, surgery, was somehow worse. Fact number 5. Cesarean sections were essentially a last resort, and also possibly fatal. Cesarean sections existed in the Victorian era, but they weren't anything like the relatively routine procedure they are today. Before anesthesia and antiseptics became standard, a C-section was performed on fully conscious patients and carried an almost certain death sentence for the mother. Some estimates suggest maternal mortality rates as high as 85% in early Victorian C-sections. The surgery was therefore only performed when a vaginal birth was utterly impossible, and the goal was to save the baby at the expense of the mother. It was considered a last resort by everyone involved, including the patient, who, if conscious and aware of her prognosis, had every reason to strongly object. By the end of the Victorian era, antiseptic technique had dramatically improved survival rates, but for most of the century, if someone suggested a C-section, it was not great news for anyone in the room. Fact number 6. Working-class women got approximately none of the above. Everything discussed so far, the doctors, the chloroform, the forceps, the lengthy bed rest, applied primarily to middle and upper-class women who could afford them. Working-class Victorian women typically gave birth with a local midwife, or sometimes with a neighbor, in cramped and unsanitary conditions, and were often back on their feet within days because household labor didn't pause for recovery. The infamous Sari Gamp, a slovenly, gin-drinking, semi-fictional midwife satirized by Charles Dickens in Martin Chuzzlewit, reflected a genuine public anxiety about the quality of working-class midwifery care. Many midwives had no formal training whatsoever. The Midwives Act, which required midwives to be registered and certified, didn't pass until 1902, 1 year after the Victorian era ended. So for the entire Victorian period, the qualifications of the person attending your birth ranged from trained physician to woman from down the street who has done this before and seemed confident. So the next time you're romanticizing the Victorian era, the gowns, the manners, the countryside estates, spare a thought for the reality of what women were quietly managing beneath all of that. They were doing it largely without information, without rights over their own medical care, and often without even a clean pair of hands to help them. That they managed to survive it in such numbers is genuinely remarkable. So which of these facts surprised you most? Let us know in the comments and check out some of our other videos here on Victorian medicine.